New Year, everybody. It is now January 3rd, I believe. And yeah, this is the first recording of 2021. Let's have a great new year. And we have a great guest today. What's up, Daniel?
How's it
Introduce
going?
yourself to everybody.
Hi there. I am Daniel Ng, and I've known David for some time, and yeah, so nice to meet you. Nice to meet everybody.
That was a very interesting introduction. Tell us a little bit about what you're doing right now.
Uh, Currently, I am a student physical therapist. Currently at Creighton University School of Pharmacy and Health Professions, and yeah, I'm in my third year now, and pretty much almost done with all my didactics for hopefully the rest of my life, except for continuing education.
Okay. You had a very interesting journey into physical therapy. Um, I thought that'd be good for like the listeners out there, especially a lot of people like me that are trying to get into like professional school or whatnot. Uh, would you mind sharing that journey into physical therapy school with us?
Are you talking about my longer, more roundabout way outside the traditional get into undergrad, finish undergrad, and go straight to professional school route?
Yeah, so like, yeah, go over like all of it. And if you think you're spending too much time on any particular thing, you're probably not spending enough time on it. So yeah.
All right. From I guess from undergrad, I took a little a little longer than usual in undergrad. Started from public school at McKinley and got to Creighton, and from there, I never experienced the college life in true its true glory. So I just started to explore, you know, didn't study as hard because McKinley is, I'm not saying McKinley's education is um, weaker than other schools should be, but there wasn't a significant effort that was needed at McKinley. So I went to undergrad at Creighton and I found out that individuals who are selected to go to Creighton University is typically amongst the upper area of their education background in whatever school they went to for high school. And then that kind of hurt my GPA, but I was looking into pharmacy because my parents are pharmacists, and I was trying to kind of, being a typical Chinese boy, I was trying to follow my parents. Found out from all the years of my undergrad that I did not like any area of pharmacy at all. And, my parents had shadowing, asked me to shadow with them. I observed their pharmacy, inpatient, outpatient, retail, skilled nursing, long-term care, all the areas of pharmacy that was typically, what most students would seek out. And I didn't like any of it. And so I was in a little rut when I was looking into what I wanted to do as a profession because basically I wanted to have a career instead of having just jobs. And so I was looking for a health profession. But all in time, I was still, engaging athletics and looking into what I like doing is just working out, engaging activity, and kind of building my own, at the time, undergrad physique is the thing. So I was looking into, making myself gains. And so I was looking into that and I realized the benefits of having a healthier movement mechanics. And I was looking into other areas I can expand to, and I discovered physical therapy. Shot a little bit, and I liked it. And so I worked in my undergraduate to get my prerequisites and found out my GPA wasn't strong enough for physical therapy school. Um, and so I worked as a technician for some time to kind of just give us some experience in the field, improve my observation hours because work anywhere in health profession, work experience can also mean observation hours, which is very beneficial to applications, and just kind of develop my interprofessional and professional skills. only to find out that this company I worked for was also kind of not blacklisted, but definitely looked down upon from Creighton University, which didn't help my application in itself because they have some issues within the management. But outside of that, I was looking for ways to improve my GPA, so I went to a master's in exercise science at University of Nebraska, Omaha. From there, I liked researching. I like understanding the complexity of the research articles of why research articles for health, for exercise and health. But I didn't want to do research as my main career focus. They offered me a PhD kind of program, and I kind of turned it down. And then I applied for the first time, didn't get in. Applied the second time, got an interview, didn't get in. And then after my third time applying, I applied, got an interview, didn't get in. Something happened, then I got in. I don't know what happened. All I know is I first got a rejection letter, then I got another email saying you've been accepted.
Yeah, so that's honestly like a crazy journey because like I feel like I've known you when you're still in grad school trying to get into physical therapy school. And honestly, like it's kind of like inspiring to me, you know. I'm very much in like a similar spot. Like I'm 26 now, I'm going to be 27 in a month. And like I haven't applied to med school like yet. Like I haven't even tried it yet. But then like I did do this grad school route as well. So like I'm hoping that after grad school, like things work out where I'm able to continue my education in medical school. But I guess like yeah, you touched up on a lot of things. You're one of the few people that from Hawaii that went to Creighton that graduated from a public high school. And I'm very much the same case. I thought we'd spend a little bit of time on that as well. I know you mentioned a little bit that like you're not trying to say that McKinley was per se like a bad school, quote unquote. But like I certainly felt that much of the same. I felt I felt very similar in that way that like maybe public school didn't quite prepare me as well as I should have. From your perspective, what do you think? Um, what were the big differences that you saw between you and your peers that graduated from like private high schools?
Oh, are you talking about like say said schools that are college preparatory schools?
Or I mean, the big one in Hawaii, like there's like three big schools I feel like in Hawaii, private schools that send a lot of students to Creighton, being like Punahou, Midpack, and Iolani. From your perspective, what do you think is the difference between you compared to like the stereotypical private school kid from Hawaii?
I think it's the mentality. A lot of times it's the individuals who came from these private schools or I like to call them the college prep schools. They're kind of groomed into understanding what it means to be a college student, whereas a lot of individuals from public school, unfortunately, a lot of the teachers there don't necessarily they have so much on their plate to kind of instead of nurturing those who can grow, there's so much on the plate for them to take care of, such as the students who are not succeeding in their classes, and they can't nurture and build those who are actually going to go on further for further education. And so the lack of preparation, the lack of mindset, the lack of kind of gearing the student up for that level of college education, say like those who make it to 10 or any other like higher education is deemed as more of a difficult program. They aren't they're much more of like a shock to them or like a culture shock to them because of just the platform is so much more vigorous and it's a lot of self-discovery upon their academic load with them versus the individuals I feel like who are in a preparatory school are already kind of expecting the type of coursework and the type of academic load.
Yeah, I think that was a good way to put it. I guess like for me, like what I was kind of like I guess going for was that the biggest culture shock when I went to Creighton was the quality of the education. You kind of brushed up on that, like the professors there, or even like the lecturers that I had up at Creighton. They seem to just be better than what I had in high school. Um, One thing I can think of in particular in high school is my sophomore year. I remember in English class, uh, that teacher told me that I maybe shouldn't pursue like, higher education. She said that like, oh, because, you're not the best, writer out there, maybe I should start, looking into something like with my hands because she knew I was an athlete. So she recommended like, being like a mechanic or something instead. And to me, like, I don't know, like I thought that was very interesting. It didn't really seem, I mean, it seemed like it came from like a place of caring, but then at the same time, it's like,
I feel it's
you're,
also exposure too. If you think, well, not to cut you off right there, but like I think some teachers they're so used to seeing others that looks like they're trying to provide that type of nurturing for what they're exposed to. Like some teachers I had also said the same thing to me, like you're never going to amount to much. And then had other teachers to say, "What are you doing in my class? Because you shouldn't be in this class. Apparently, you should have been whoever had you for the previous year completely underestimated you."
mhm.
And yeah, so it's all depends on I feel the teacher's exposure as well.
Mhm.
So it could have just been your situation scenario was you just didn't have the right teacher kind of give you that platform or give you that kind of exposure.
Well, I mean, like if I'm gonna be completely honest, like I mean, I don't really know how else to say it, but I think she's honestly like a, just not a good person in that regard. Like I don't think
Uh,
she really cared about her students. Like I'm sure, out of a lot of people out there, like I'm not the only one she had that talk with. It'd be kind of interesting to see like what other students or who else out there had like, that talk and see what they're doing now. I don't know. I just thought it was like something. I wonder. I really don't know if it's like universal to like, my school or maybe like something in like public schools around the state. But yeah, I just thought that was like, huh. Yeah, I still remember interactions with specific teachers throughout the years that definitely like, you know, made me feel particular ways, at any particular time or whatnot. Okay, so the second thing I wanted to talk about, from your little like monologue earlier, was how both of your parents are pharmacists. Did both of your parents want you to be a pharmacist when you were in undergrad?
Never once has my parents ever said you should become pharmacy.
Um, I know, okay, in a lot of like Asian households, like parents have very high expectations for their children. Uh, did your parents have like any expectations for you to become like a doctor or like, have like an advanced degree or anything?
Um, let's just say it wasn't mentioned, but it was implied.
So,
So
um, how was that conversation when you told your parents that, like, oh, I don't think I'm going to pursue pharmacy? Did you already have PT lined up immediately after that, or was there like a break where you didn't quite know what to do?
there was a small period between my junior senior year of undergrad that I was I just pretty much said no, not a pharmacy because when I first started in pharmacy, it's more like how I have a few cousins that have pursued their higher degree because said maybe a sibling or a parent has become that way, and their passion is they can succeed in the program. They have succeeded in the program, but I feel like their passion to the profession isn't as bright or vivid as their person they were trying to follow or look up to. Um, and so when for my scenario, for my journey, when I was into looking into pharmacy, I that's why I worked with my parents. I shadowed, I observed, I interacted, I tried to get as much exposure as possible. Was in there in the titration room. I was there for the mixing the drugs. I was there, just packaging, watching the vitamin, the mineral counting or the drug counting. just everything about pharmacy. I was trying to kind of get myself involved in. I'm looking at it, I just couldn't get into it. It just didn't have that desirable response within for me. And so junior year, I was just like, I was just beating a dead horse. I was like, this is not going the way I wanted. Nothing's going the way because it doesn't seem like a career I want to choose. And that's also the same year I discovered physical therapy because of the Creighton has all these career fairs and all these little exposure things. And I was already starting to look into exercise science, and I'm realizing that exercise is more than just aesthetics and strength and looking, really attractive and getting that washboard abs, but actually using exercise as a mode of medicine and movement. And I was starting to realize that, but it's like when someone's too deep in, it's hard to turn around. But I turned around because I knew this wasn't good for me, or it wasn't going to be conducive to my personality. So when I told my parents that, to be honest with you, my dad said, "Good, I'm happy." And I was like, "Why?" He goes, "Pharmacy is not the same profession he used to know." And my mom was right on the same path. She's like, "Oh, that's okay with us because pharmacy isn't as pretty as it could be, as it used to be." And this is also a certain time where a lot of healthcare insurances were changing. So my dad was even more, assertive of, yeah, no, pharmacy is not a very pretty profession anymore. And so when I told them about physical therapy, then they were like, "Oh, good. Can you do it? Do you like doing it? Good. Then make that your profession."
Well, yeah, it's very good that you have very supportive Asian parents. Like, there's Asian parents always have that stereotype, right? Of no, like they're dead set on like one thing, right? And it's like you have to do what I'm doing, or you have to do what I couldn't do, or something. So I'm very glad
More
that
of those.
I'm very glad that like you have parents that are very supportive and whatnot. Okay, but next I wanted to talk about life after undergrad and like realization of, oh, my GPA might not be competitive enough to get into like physical therapy school. Could you like in a sense like talk about that for a little while?
Yeah. For me, and kind of how I'm glad, like, talking to the admissions advisor, because my current admission advisor for Creighton was actually the old director, or not the vice director of admissions at Creighton University. And I was just like, it took me 7 years to get into physical therapy school from undergrad, after undergrad. And I was, working as a technician, going through my master's, trying to get through, some things. I didn't know about the master's program until I talked to the admissions director. I'm like, "Hey, what do I need to get in?" Because I did a tour of the school. I've interacted with a lot of alumni, interacted with the professors, and I was like, I really want to be a physical therapist because the what it stands for, what it does, is fantastic. And he goes, "Well, you get your observation hours working. That's my observation hours." And then he goes, "You need to get your GPA higher." So I go, "So what should I do? Should I go back to Creighton, take my classes or redo classes?" And he goes, "Well, unfortunately, Creighton's policy is if you have a C, it doesn't necessarily qualify you to retake that class." So he goes, "I'm sorry, you're kind of stuck with that position, that grade. But you can go to a master's program, and then from there, if you score a well enough GPA, you can that would supersede the lower GPA, lower grades you had, and that could improve your chances of getting in." And that's why I did the master's program at UNO. And so working as a technician while going to grad school, because I don't I've one thing you don't know is that I was born relatively fortunate. My parents have enough finances to support me, but I didn't like the fact that everything can be given to me.
Mm.
My parents always tell me how much they had to struggle when they're growing up, and I took that and I was like, well, what does it mean to struggle? And so my dad's like, hey, I help pay for rent. You can come home, relax, find yourself. I'm like, no, I'm going to work. I'm going to drive a car that is barely running. I'm going to survive in -10 to -15 to upwards to -40 degree weather. I'm going to suffer because my decisions are my decisions. I made this decision to pursue my own degree. I'm going to follow through with it. And my dad was like, you don't have to suffer. I made sure that my children don't suffer. I'm like, no, if I don't grow, if I don't endure, I don't grow. And so I stayed up, worked, paid for my own rent, lived in quite okay housing, not the greatest. Drove a beat up car, worked, paid my own way to grad school. Thankfully, UNL was affordable. And then after that, I started, coaching soccer, coaching middle school soccer, started personal training because one of the things that the master's degree gave me was a discount code for a CSCS, which was a significant improvement for my kind of my training mindset and my physical therapy exercise prescriptions. And then from there, eventually, as I got through, my grad program, then things kind of fell into place, and then I got in. So that was
Okay.
the long journey.
Mm. You actually brought up a lot of interesting points in that last point that you addressed. Yeah, I guess I wanted you. Okay, a lot of us like have played sports like throughout our lives. Some of us were fortunate to play sports in high school, and even some of us even more fortunate were able to play even further. What was it like for you making the transition from player to coach? Like this was your first time coaching, right? Like that's really
Yeah,
interesting to me. Like a lot of us are eventually going to be starting our own families, maybe in like the next like within the next 10 years or so. Like, and that might even include like wanting to coach like your son or daughter's like little league team or whatever. Like what is it like coaching your first team?
I can tell you this: not every player can be a coach, but then so on that vice versa, not every coach can be a player. There's a mindset. There is a training and building mindset. Just because you played, say, sport is baseball for all these years, like you have, is like that doesn't mean you can be a pitching coach because you're a pitcher. But then again, there can be somebody who's absolutely terrible but has the vision and knows how to break it down. But they can't demonstrate it, but they can break it down and actually improve. But that's why coaches are coaches. That's why it's just a lot more players than there are coaches. And low key has sometimes get paid way, way better than most athletes. It's because they have the mindset.
Mm-hmm.
And I mean, when I first coached, it was challenging. Uh, I wanted to just show and demonstrate what I know, and then I realized that doesn't actually help my players grow. I had to change the way I approach things. So I I looked into how different formations are appropriate for soccer. I looked into how what every player strengths and skills are. We had those standardized. All right, how fast can you run? Okay, what position do you play at? And then put them in the position and kind of observe how they play. It takes a whole lot, especially since the program I was working with. It was once a decent program, but in the past few years, they kind of trickled down, and their quality of play has gone down, and the participation dropped. And it was a low income area, heavy Hispanic, heavy African American, and So they had the talent. In fact, some of them were actually recruited by MLS teams at middle school age. But they didn't have the coaching finesse to improve. So when I hopped on with the coaching staff, because there's another person that was there, we went from maybe making city tournaments and that's about losing the first round to literally the finals, and we lost it by 1 goal. And then next year there was a significant turnout because everyone was there, and then we won city. And then next year, coach after that, we won city again. And the year after that, we won 3 times back to back, which hasn't been done in 10, 15 years in the Omaha area. But like I said, it wasn't me just sitting down and just be like, all right, kick this ball. It was more like it takes that mindset of taking yourself away from being a player and kind of look into what helped you become a player. And that's I think it's actually a lot easier to say, but a lot harder to do.
Yeah, that's a very interesting perspective. Like, okay, I guess going back to like physical therapy, how was being once upon a time a player and then having experience as a coach, and how are those two things going to help you be a better physical therapist? Or does it have any influence into how you think you would be as a physical therapist?
Physical therapist, actually, to be honest with you, is a lot like a coach
Okay.
because you have to look at your patients. You have to see how they act. If you are doing something and they are absolutely rejecting and refusing, not responding the way they should be, if you are you just going to keep hitting your head until dead ends and hitting your head against the wall and not realizing that this is not going to work, regardless of how much you know it's going to work? You have to change your approach, and coaches have the ability to change their approach. Like you see some coaches in the NFL or anything, like if the ones that just yell, like for example, Nebraska had Bo Pelini. He was known as the most aggressive coach in NCAA football. I think one of them. Some players loved it. Some players don't. They actually had some abuse cases against him. But like he was so headstrong about his own ways that he kind of threatened and kind of scared players away. But other coaches that are too lenient, so it has to be a balance between understanding what type of approach a person responds a lot more positive to. I can, if one can yell, a therapist can yell, that may not work for a patient who doesn't like being yelled at.
Mm-hmm.
But an athlete is like, if you yell like, "Hey, let's go, come on," and they're like, "Oh, I like this." You're telling me what I need to do, how I need to approach it. That might be what they need. That that slight little push in that manner would help them. Versus another person, "Hey, let's go, come on," like, "Hey, can you stop yelling at me?" Then you'd be like, "Oh, hey, that doesn't work." Well, that's why the coaching and physical therapy kind of help get how to work hand in hand, because there's a lot of that approach of how can you tailor a therapy session, even though it's by science, it has proven to that it's tried and true, it will work. But if somebody doesn't want to ever take in it, doesn't matter.
Okay.
That's why coaching and physical therapy are, I think, hand in hand.
Yeah. All right. So next question for you. How different is it treating a patient that's an athlete or maybe even like a former athlete compared to say somebody that isn't, who hasn't really played like sports?
Oh, okay. So, it's challenging, but it also depends on their exposure. Like I know somebody who's been an athlete because back to what I was saying earlier about how to talk to them. An athlete needs that type of motivation. Like, "Hey, let's not beat around the bush. Let's do it. Stop. Why?" Like when patients do something that you see and is a habit form that's not conducive to their health, say like they're knee problems and it's an overuse injury. If it's an athlete, you just tell them like, "Hey, what are you doing?" And they're like, doing what you told me to. And like, but you can just straight up tell them, is it helping you? No. Then why are you doing it? And they sit there and they go, I don't know. That works. But if you tell somebody who has no physical, previous exposure to physical activity, they don't know what they're doing. They don't know that what their movement mechanics are is actually causing their overuse injury. They still do it because that's how they're taught. But once you expose them, you can't just be like, hey, why are you doing that? And they're just like, well, because I had to. This is how I was told to do. This is what I'm known to do. This is what helped me get to this point. How are you going to tell somebody that their car that they love is not good for them? You know, it's like, how are you going to tell them that their way of doing things is wrong without saying that you are the problem? No, you can't say that to the patient because the patient's going to be like, whoa, wow, well, screw you too then, you know? But, you know,
Yeah.
you have to really adjust your mode of your approach. And so, you know, a patient who has no previous education or previous exposure to a movement, you have to show them it takes a little more discovery. Whereas an athlete, they've experienced it, but a patient hasn't. You got to train them into that. And actually, at the end, you can tell the patient that hasn't been exposed to physical activity. You can kind of actually talk to them like an athlete after a while. You can kind of like, hey, they're like, yeah, what's up? I go, you're doing it again. And they're like, doing what? And they stop and they go, oh, that thing. You're right. Oh, I'm sorry. I went back to my bad habits. And like, yeah, why are you doing that again? And they respond back. That's how you know you've developed a good patient therapist relationship. Is you like you can talk to the patient like an athlete. Because athletes trust their coaches, and so patients have to trust their therapist, and that's kind of one of the benefits of being that level of education and it's exposing your patients to the right things, and that's how you develop that. And that's why I think is one of the biggest challenges. But once you get that, it's a very effective manner of education.
Okay, I have to ask, do athletes get injured more often than, say, non-athletes?
Depends.
All right.
If anybody listening to this podcast is a physical therapist or a physical therapy student, I'm sorry, I use that word. It depends. Because the mode of injury is a large factor. You're going to see. I mean, when you get to med school, David, the big thing is what's the MLI, the mechanism of injury. Athletes, a lot of times, when they're in the issue, when they're in the treatment room, or they're there for therapy, or they're there for whatever, it's because of a mechanism of injury of trauma. If something happened, some player's foot was under the landing spot, rolled their ankle, landed kind of weird, ACL blown out, landed too hard, or the forces are wrong. It's patella tendon tear, rupture, quad tear, but you won't see low back pain, a chronic low back pain with the athlete unless or overuse or they had a long-term injury. You won't see gluteal dysfunction in an athlete, and if it is, then they turn into a overuse injury because they're so hyper fixated on fixing that issue that their physical therapist or their coach says something. They're so focused on that because they're trying to get that little extra bit to improve their abilities, and it becomes an overuse injury. But when it comes to rates of injury, I have to use the word it depends. It really, really depends.
Yeah, that's just a question I've always had throughout the years. Like, yeah, if like, even like, okay, do more athletic people get injured than, say, like not as athletic people? I've always wondered that too. Because like if you look at like basketball, there's like a lot of guys that you consider very athletic, like take like D Rose, for instance. Like he's had pretty much every injury imaginable, but then people would say he's very athletic. But then you compare him to say somebody like LeBron James, who like seems to never get injured. Like I always wondered, like why are some people more injury prone than others? I don't know if you know the answer to this question.
Well, for me, from what I learned from just my exposure to athletes, is
Mm-hmm.
those who I see when I was a coach, I had lots of players that had a few were concussions, a few with the broken arm, one with some guys. It's their motivation and their rambunctiousness, and a lot of players I notice that when they are going for, let's say, for example, soccer, they're going for a tackle. Some players are a little more hesitant, and some players are a lot more aggressive. In baseball, for example, a player is gonna if a player is on first base trying to catch the ball, and the runner's trying to avoid him, but the first baseman is blocking the way. A runner is gonna plow right through the first baseman if they want to. I mean, or they could just daintily tap around it. Most times, just plow right through them, and all really depends on the mindset of the player, athlete.
Mm-hmm.
In soccer, you see very aggressive players. You see guys who would slide tackle others. You see people who push, fight in any ways, and you'll see other players who are not the same. The
Mm-hmm.
ones who are kind of a little more hyper aware, kind of like more dainty around their interactions with the other players, typically don't get hurt as much, but it happens. But the ones who are a little more aggressive, rambunctious, and kind of crash their way into things, you see those type of injuries, unfortunately.
Mm-hmm.
But when you're in the zone, like I'm pretty sure you've experienced that, when you're in that, I don't care what happens to me. I want to do this the best I can at this particular moment. AKA, when you're in the zone, you don't necessarily think about, oh, am I going to throw my shoulder out? I don't care.
Oh,
Am I
okay. Honestly, like all of my injuries, like I don't know, they're very weird. Like one in particular was my hip flexor. I wouldn't say it was isn't quite what you're describing. For me, it was like trying to steal a base. Like that first like rotation to try to like steal the base was what caused it. But yeah, I don't know. I just always thought like, huh, why do some people get more injured than others? Because I've played with many people that seem to always be injured, and then like yeah, there's some people that seem to never get injured.
Okay,
Uh,
another thing you brought up a good point. I brought up forgot some major portion things is the keyword in biomechanics.
mhm.
Big word that is often misplayed because, for example, if you watch players who have MCL, you know, injuries, if someone hitting the knee from the outside, ACL, their knee was in the wrong spot. But you heard talks about, oh, you can reduce knee problems if you have the proper hip mechanics, if you have proper hip and ankle movements, you can reduce the amount of knee forces. That is absolutely true. Uh, Biomechanics is huge, but at the same time, how do you calculate the appropriate body movement in a split second? How do you know, for example, oh, I'm gonna blow up my ACL. Oh, nobody knows that. How do you set your body to prepare for that? Sometimes you
Hmm.
can't, but there are ways to kind of identify it, and that's what kind of physical therapy helps build, is that ability to sense the proprioception and somatic senses, so you can give your body to adjust to proper biomechanics
Hmm.
to correct that, to prevent, hopefully, any particular scenarios, and to not become injured. No, that's never going to ever happen. Injury is an injury. If
Hmm.
somebody's going to take out your legs, they're going to take out your legs. You can't prevent injury from that, but
Hmm.
you can blow your ACL from going down the stairs. but you
Mm.
can prevent that.
Hmm.
And so,
Yeah, that's an interesting point because I guess to talk about another one of my injuries, I dislocated my left shoulder like years ago when I was still playing baseball. It was when I was swinging a bat. And like for the longest time, okay, maybe like for like a few weeks up until that point, my left shoulder always felt off. And then, as an athlete, you kind of just learn to play through the pain, right? And then eventually one day something just happens and it's like, oh boy, now my left shoulder is dislocated. And now you got thrown out by the left fielder.
mhm.
But but yeah, I don't know. I've noticed for myself there's a lot of like tells in like certain things where it's like, oh yeah, maybe I should like take it easy or else like I'm really risking it. And like the thing I'm dealing with right now is like, yeah, my soleus running has not been very hot as of late. So I've been trying to take it easy. Because yeah, that's one thing that scares me, like an ACL tear or like a Achilles like rupture or something. Like yeah, that's
You
it.
can actually function without ACL. So thankfully, that at least you got your rest of your body to take care of that. But I get
Yeah,
your mean.
yeah.
But let me ask
Okay,
you a question. Kind of further on that statement you made there.
yeah. All right.
When
Uh,
did you learn yourself? I mean, I know you're interviewing me, but when did you learn yourself how to be aware of possible injuries? Yes, there's a nervousness, a scared, you're scared to tear any ligament, etc. But when did you get that self awareness of, oh, this might be dangerous for me. Oh, I'm in the wrong, my knees in the wrong spot. Oh, my arms doesn't feel right. Maybe I should not do this. When did you learn that?
oh, okay. Well, first I want to address that. I don't really consider this like an interview of you. I consider this like a conversation. So feel free to like ask me any questions at like any time. Like, yeah, no, we're just here to have fun, like, and then just talk. Um, Well, okay, I'd say yeah, my left shoulder was the first time I was ever conscious about an injury or like, maybe something leading up to an injury. For me, if I remember correctly, uh it was just always had like that joke like, oh, on a scale of 1 to 10, what's your pain level? Like, yeah, for me, I can honestly say like, yeah, it was like pi, low but never ending. You just felt like it was off. Like it just didn't feel like right. On top of the pain, I also like noticed some like mobility issues where it's like in certain positions, yeah, my shoulder definitely didn't feel right. So like when you extend your arm when you're just swinging a bat, through the follow through, it just never felt good when leading up into that injury. And then just one day, yeah, it was during the follow through that it dislocated.
Yeah.
Yeah, and I honestly think I'm more aware of like my body as compared to like a lot of other people. Um, especially I don't know. I've had so many. I've had countless injuries. Like I've been in and out of physical therapy probably more than like most people that are 26 years old. Um, I guess like to elaborate on that, like yeah, I've been into physical therapy for the first time for that hip flexor injury, and that was rough because like walking was a struggle. I couldn't even like squat down to pick up something off the ground. Like that's how much like my hip flexor like hurt at the time. Luckily it was only a strain. It wasn't like a torn hip flexor or anything. And then after that, that kind of prepared me for when I strained my rotator cuff. I think for me it was the supraspinatus, and that was rough because like I was out. I couldn't like even throw like a baseball for at least like 6 months. I want to say it was about a year before I even like started really getting back into it. So like yeah, there's that, and then like even recently, like I dealt with like a left knee problem, and then after that, I also went back to physical therapy recently. The most recent time was for right shoulder pain. Uh, Unfortunately, I don't think I had enough sessions, so like that didn't really help. But like at least I had the experience from before to draw on, and I could like kind of do most of those things on my own. And you helped a little bit with that too, so
Yeah, I'm
a
laughing
shout out
because
there.
I'm laughing because there's a you opened up a can of almost opened up a can of worms there
No, this is perfect. This is
about
perfect.
sub treatment based off of insurance because I'm pretty sure the therapist that you're working with was going to eventually figure something out if you didn't have such limitations.
Mm-hmm.
I'm pretty sure. You mean a new therapist versus a seasoned therapist? Yes, there is a level of skill. I mean, I'm probably going to be like that a greenhorn therapist that is going to have no idea what the heck's going on. But at the same time, you're not going to. It's like, you become a surgeon and you have to do a complete spinal fusion. Say someone has scoliosis, you're doing a spinal fusion. Oh, by the way, you have 45 minutes to do it. You're never gonna do a good job. You're never gonna understand and fix everything. You're never gonna do your job appropriately because you don't have enough time.
Mm-hmm.
You know, it's you kind of open up a can of worms there. I don't want to go any deeper than that because that legitimately is, well, if you look anything in healthcare, that's a problem.
Mm-hmm. Yeah,
But
definitely.
but yeah, like when it came to this, like a lot of individuals who have strains and sprains, etc., typically they have two responses. One, the athlete response, like you just mentioned earlier, fight through the pain. Not always the best way to go about it, but it's a way to go about it. And then you have the opposite one, stop and don't do anything at all. And that opens up another problem because then they have poor healing, improper healing, contractures, scar tissue formation,
Mm-hmm.
lack of muscle function, atrophy, and then for physical therapy, you have to deal with both ends. You have
Mm-hmm.
those athletes, you gotta tell them straight up, like, I know for when I helped you out, I had to tell you, David, stop. And that
Yeah,
was
like
actually what you needed.
yeah, like I guess that's like really interesting. Like you kind of like touched up upon like I guess how my philosophy working out has changed over the years. Um yeah, I guess this kind of leads into like the next thing I wanted to talk about. Um it's the new year. Everybody wants to start working out, you know? Like I can name like at least like 10 people off of my, the top of my head who want to, you know, get
Make
more fit.
positive,
Yeah,
fit
get no, what they say
evolutions.
is get more fit, whatever that means, But like, yeah, like going back to like, how my philosophy has changed over the years. Yeah, certainly when I was in high school, my like perspective was like, oh, you know what? Screw it. You got to fight through everything. It's like you just got to do it. And then I started to get a lot of injuries, and then it started to be like, oh, maybe I should just rest a lot. But then I realized like, oh, my whole body is getting weaker. And I was like, and I think I got like a couple more injuries, because I rested too long, and all the other muscle groups or whatnot started to become weak or whatever. What's the word I'm looking for? Yeah, I'm a little slow mentally today. I don't know, just a little tired. Like,
That's all right.
I mean, honestly, like I'm like 4 or 5 episodes in already. I'm pretty sure like my viewers and or listeners already know that. Like, yeah, there's some days where I sound sharper than others, and just today's just not one of those days. But
That's
like,
all right.
yeah, it's just like, yeah, it's certainly changed back to, okay, if I'm injured, I'm gonna do everything I can up until the point that I start to feel pain, which is why, like, in a sense, like I still go like running and jogging now, even though I'm dealing with a soleus issue. But what I realized is that I can't really do hill sprints anymore. Like when just running on uneven like terrain definitely aggravates it more than say running on flat. So like as of late, I've just been staying on flat ground. I'd like to
Hmm.
slowly build up to the point where I can start running on hills and whatnot again, but like I understand that like yeah, my body has to deal with this like thing first. So like yeah, it's certainly crazy how much my perspective has changed in terms of like working out. I guess from like, you're more of an expert in terms of working out and like physical therapy or like, anything fitness related than me. Like, what do you think a lot of the people who may not have worked out for the first time or who are starting to work out for the first time in a long time, like what tips would you have for them?
I'd say start slow, um, because it's like alcohol. You can't start your party out by chugging a whole handle of vodka. Everyone knows, regardless of thanks to all these movies and etc. and most people personal experience, that's never going to lead to a good night.
Mhm.
It's going to start you off very, very bad. Exercise is similar. Another way to look at it is an individual who hasn't exercised in recent times or done that much level of physical activity that they want to, they see on TV or whatnot. They don't. It's like starting a car that hasn't started in a long time. Why do you do car maintenance? Like, why do you change out get new gas in? Why do you change the oil filter? Why do you get new oils? Why do you fill your tires up? Why do you clean the car? Why do you have all these other things you have to do to maintain the vehicle? Why do you have to get new brake pads, in fact? Stuff like that. Like, why do you do that in the first place? So the car can run better. The car can function appropriately. If any of these areas are key areas that are sub-functioning, the car might break down and actually cause more problems, or might, not work at all, or have further problems. Your body's the same way. You can't just cold start and just go. You have to do the proper maintenance. You have to build yourself up to prepare for where you want to be. Exercise, I tell one thing I tell my clients when I'm from a personal trainer is I have to talk them out of the idea of fat loss. Fat loss is great, but exercise is a lifestyle modification. An ex-phys professor of mine told me exercise is a drug. And if you know neurology and actually general biology, exercise is actually a drug because they have a lot of hormone secretion. There's increase of serotonin and dopamine and norepinephrine, and all these hormones are functioning. BDNF. You have your adrenaline. You have all these other hormones functioning when you exercise. Now, yes, it's a drug, but at the same time, too little of it, aka atrophy, can set in. Your body goes, I don't need that. Too much of it, you have issues. You gotta find that sweet spot. It's actually a really nice big sweet spot.
Mm-hmm.
For those who are pharmacy students or pharmacists, the therapeutic index is large. Good. You need that. And so when you have that, you can't identify what your sweet zone is if you go too hard in the first place. You do what you think you're able to do if you haven't worked out in a while, and all of a sudden you go, oh, well, I'm exhausted. Or ouch, or something hurts, something went wrong. You're not prepared for that. And then your normal response is to stop. And if you stop, you're not doing yourself any good either. And so the sweet spot, start slow, is build yourself up to that. And so when I tell my clients to the fat loss perspective, yes, I get it. Your goal is to lose fat, but to why to lose fat? What is the benefit of that? Is it for aesthetics? Is it for health? Is it for something that has always been something you wanted to do? Find something that is, that triggers you to maintain that. And you don't find a way to go about that if you start fast. You just go straight hard into it. Some people have the mental fortitude to go through that. But then also you end up in physical therapy because of, an overuse injury now.
Mm-hmm.
So work your way to that. It's a very difficult perspective. And sometimes you do need coaching.
Mm-hmm.
And a lot of people do need coaching. Some people think that coaching is not effective, but there's a reason why coaches are always there.
Mm-hmm. So it's valuable for some people, but not so valuable to others.
Mm-hmm.
Okay. Here's like another question I have. So I have a friend who wants to start working out again, and he has had issues in the past with his back, and like he's in a sense like afraid of like re-aggravating that injury. From your perspective, like what's the best way for somebody like that who has dealt with injuries in the past to like slowly get back into like working out?
The first thing I would say is don't disregard your injury. a lot of individuals like working through the injury, thinking that it'll work itself out because a lot of times small injuries have worked itself out. That's never a safe bet. My first approach, if as a therapist, is why does injury occur? What about the injury irritates the person? If it's the movement, how are they moving? Why are they moving this way? If it's the appropriate, if the movement looks absolutely appropriate, the appropriate muscles are firing, what caused this injury? How did it develop? Why is it an injury in the first place? If it's moving appropriately, it shouldn't be an injury. If the rest of the body mechanics are functioning appropriately, it really shouldn't be an injury. It could be traumatic. If it's an improper movement, that's a little easier to work with. Harder to identify, but easier to work with. You just work on that to then incorporate to the whole of the motion, and that's how you identify any kind of, you probably hear the word muscular imbalance. Now,
I have a lot of those.
A lot of people do. I'm not immune to that. I have a lot of muscular imbalances, but when it comes to an individual trying to train with the injured back, why the back is injured is kind of a factor. Is it, if it was traumatic? Most times, traumatic injuries, say like they during deadlift and they strain the back. The actual answer is to stretch and do low intensity exercise to recover that. Now, most people don't like that because it demasculizes. If it's a guy trying to lift heavy, trying to go big or go home, they want that. Why should I lift these lower light weights that I could just blow through earlier? Well, it's because you didn't do that in the first place. If it's a person who lifting weights, but they're not utilizing their appropriate mechanics, I'll teach them that. And so sometimes it just takes a skilled eye to observe what actually is causing the problem. Seek third person perspective, seek third person help. Seek that out. That actually, you might discover something that they didn't know about themselves. I mean, I still do. That's why, even though I'm a therapist or a therapy student, I have my classmates, I have my professors point out my not abnormalities, but like my defects or my movement mechanic issues.
I feel like that's certainly like a skill that most people have to learn, though. Like a lot of people ego lift, but I feel like that's like not only for like lifting, like it's like almost any individual's like like any particular like part in anybody's life, really, where like some people just let their ego get like in the way of things. Like I'll admit, like I used to be like really like that, like, but now it's like I've kind of given up on like trying to like protect or like defend my fragile ego. But and like
ego is important.
Yeah, that's certainly where I start to make better gains in like the weight room or whatnot. Like now I feel relatively healthy. I'm not as strong as I used to be, but I feel like I can definitely move very well nowadays. Like I was never able to do like a pistol squat before, and now like I can do them pretty easily. So like I'm very happy about that. Like my mobility is better, and like I still have like pretty good strength. Like I guess that's like an interesting perspective too. Like having not really like I guess talked with you before, I didn't really think put much thought into like mobility. Like yeah, I just thought that was like a really interesting point that you brought up.
Well, actually, a fun little thing that I've noticed throughout my years of first working on myself, then evolving into more of this movement is medicine kind of perspective, is a lot of times individuals exercise, they're looking for a gain, they're looking for something aesthetic wise. Now that's fine. If anyone wants to have the massive 24-inch biceps, have pretty much their arms not fit in any notable known shirt, yeah, that's the thing. That's fine. I'm not saying that is absolutely wrong. They should never do that. No, if somebody wants that, then that's their own, it's their motivation. That's great. For me, my perspective, what I like to do is avoid exercises of futility. Meaning, yes, I have massive quads. If I worked out, I can squat an incredible weight. My back is, yes, I can deadlift great weights. But if I can't run faster than 5 to 6 miles per hour, um, what's the point of having these massive quads? It really depends on it really depends on your personal goal. So ego is fine. Don't get me wrong, ego is fine. Ego lifting is great. Now,
that's a hot take.
Ego
Coming from a
lifting.
physical therapy student,
Well, here's
that
the
sounds
thing.
like a very hot take.
What is ego? Ego is confidence. If you have big egos, you have probably overconfidence, and you can work
that's the
that.
first time I've heard it like described as such. But okay, I see where you're going with that.
But you can use ego to their advantage. Like there's sometimes I work with a patient and they're like, "Hey, let's do this." And I'm like, oh, why? Why do I have to do this? Go, hey, there's a really cute girl down there, and then next thing you know, they're like, "Yeah, let's lift, let's rehab my shoulder." And it's because it's like, I'm like not saying, hey, another cute, cute person there, go ahead, hit on that. But like sometimes it's a play on their ego to help improve them, because injury and perception of injury is a delicate psychological perspective, and sometimes you need the ego boost to help with that. That's why the ego is useful.
Can you expand on that, like the mental side of physical therapy? That's very thought provoking.
I mean, mental, like
how do you, as a therapist or like as a personal trainer, how do you, in a sense, like help them have the right mentality to go through therapy or to make gains when you're the role of like personal trainer?
That's a heavy question, David. That's
The good questions coming out like only now.
I'd say this: when it comes to let's see, I gotta think of something. This is like a heavy question.
Yeah.
Um,
if you want, like, I really need to use the bathroom. So I could like step out and give you some time to think about it.
yeah, let's take a break and we'll come back to the question.
All right.
Hey guys, just a quick break. I wanted to talk about our sponsor of this podcast, Anchor. Anchor is a free all-in-one podcasting suite accessible on any computer or mobile device. I've been getting a lot of questions, honestly, about like, how did I start my podcast? And my journey started with me trying to find a software which allowed me to do everything I needed, such as recording and editing. And honestly, like Anchor like went above and beyond that. It definitely makes it easy for you to get published on various popular apps such as Spotify and Apple and Google podcasts. And it also helps you get monetized by setting you up with sponsors as your channel or your podcast begins to grow. Even if you're not like a podcast creator, you should definitely download this app, as you can find your favorite podcast and listen to it there, or you can explore and find new podcasts like these. So yeah, download the free Anchor app today from the Google Play Store or the App Store, or go to anchor.fm to get started.
Okay, so I hope you didn't say anything embarrassing, because I'll definitely hear it when I'm editing.
All right, so
all right, and we're back. So yeah, go ahead.
The question was about like psychology and injury.
Mm-hmm.
I guess to help my explanation is, can you tell me how you felt when you got injured?
Ooh, which time?
Let's go with let's go with two. I want you to go and explain two different areas. First one would be your first major injury that stopped you from sport and stopped your daily living activities, such as like your ability to shower or something?
Okay, I guess for me that would be the hip flexor. Um, I wouldn't say like it really like prevented me from doing like, activities of like daily life or living. The only thing I could really notice was like walking didn't feel good. I definitely couldn't run. Like yeah, like like bending down and stretching it in like particular ways definitely aggravated it. Um, Honestly, I don't know. I was always pretty optimistic. I always was very hopeful that like, oh yeah, just got to get through this physical therapy, then I'll be back out on the field.
So,
But
uh, were
but
you
I don't know. I feel
trying
like I'm
to
very
get rid
different
of
from
the
most people
injury
though.
as quick as possible?
Um, yeah, I mean, certainly it was just a lot of trust in like the PT and like the tech that was working with me. I definitely like trusted them a lot. I certainly realize that I'm very different from like a lot of other people who might think that, oh man, like this is the worst thing that's ever happened to me. Like I'm never gonna bounce back from this.
So
Like,
let's say you had so yeah, you kind of I mean I appreciate you giving a shout out to physical therapy, but um, was there a sense of frustration in how much pain you experienced and how much it changed the way you moved? Like
um,
you wanted to step up the stairs, like, every time you stepped up, oh yeah, it hurts, etc. Did you have any of those
well, I mean,
episodes?
I was like dosed up on so much pain meds at that time. Like I mean, I certainly remember what it felt like when I injured it, but then the pain of what it felt like while I was rehabbing it, I don't necessarily remember. I just remember like not being able to like do like a squat, and like that was like the test to see whether or not if I could ease back into the sport that I was
Now,
playing.
did it frustrate you that you could not play a sport? You had to take a break from sport.
Uh no, for some reason at that time I remember thinking, oh, okay, like I had a really good physical therapist, so in that time they found a lot of other muscle imbalances, so I was able to address that, and I felt like
Okay.
after physical therapy I was able to become like stronger.
Mm, that's
So like
big.
I had a very I felt like that was like a very good experience for a first time having to do physical therapy, because not only did I take care of that particular injury, uh, like they also that team also my treatment team also like helped me deal with other weaknesses in my legs and like core in particular, which
Mhm.
I feel like ultimately helped me be a better athlete coming back. Like
Okay.
and I feel like that's like that happened that time, and that happened with my second injury. Uh, yeah, shout out to I guess like sports med as well. Like yeah, so on top of my shoulder injury, they also helped me like build up leg strength and whatnot. So that's very important for like a pitcher and whatnot. So yeah, like early on, all of my experiences in physical therapy have been very positive.
Hmm. Well, I guess I couldn't branch off of that as much as I thought I would. But so what I was trying to go for was that, I mean, don't get me wrong, glad you had a absolutely fantastic therapist that worked with you, and glad
Mhm.
he actually explained and kind of identified areas that you can build and targeted. I'm pretty sure the therapist was able to talk to an athlete like you are,
Mhm.
and that's probably what helped your overall function. But a lot of times when someone gets injured, say like example, say a geriatric individual,
Mhm.
um, they slipped and fell because the last step was wet. Because they fell where they fell on, they had a hip fracture.
Mhm.
The hip fracture is unfortunately very common and a very absolutely excruciating bone fracture, because everything about the hip is supposed to be stable and support everything that's above it too. Well, hip fracture occurs, every step hurts, every way movement hurts, everything hurts. And it's not like a small, like, oh, well, low, achy hurt. No, it's like absolutely sharp, stabbing, excruciating pain. And
Mhm.
there's so much inflammation about that. It is absolutely debilitating to the
Mhm.
point where they don't want to even move. And
Mhm.
most of the time, hip fractures require immediate surgery.
Yeah.
So their slip and fall required them to give them an experience of absolute excruciating pain. And then next thing you know, it led to them getting a possible hip replacement and a surgery that was to fix the hip issue. And then they have to recover from the hip issue, for hip surgery. And then they have to go to physical therapy to regain the muscle and the tissue that was either cut open or, I hate the word use word destroyed, but they had to be modified. And so a slip and fall led to a plethora of other just uncomfortable things. Do they want to ever go to that spot again to slip and fall again?
Probably not. I mean,
Exactly.
well, I mean,
But
you bring up a very interesting point because, like, yeah, that's also on the assumption that that geriatric patient is a candidate for, like, say, a hip replacement. I feel
I'm
like a
saying,
lot of, from my experience, like from what I've heard and like seen, I know it's anecdotal, but like, yeah, a lot of people who slip and fall in like those in that age range are unable to get surgery for, I guess, like the risk to reward ratio, isn't quite there for them. Yeah, like, have you ever had to deal with any patients in those situations?
yeah, multiple times
Like,
actually.
like, oh, that's interesting. Tell us more.
Um,
Without, of course, HIPAA, we like without,
so
getting.
there are patients that I've worked with that were, you know, um, it was a hip fracture from a fall, slipped, and the biggest thing that we had to work with was actually psychological.
Mhm.
There was a huge trauma of stepping down.
Mhm.
Yeah, if it's a random step that is railing left and right, stability, oh yeah, without any problems, you can step downstairs. Of course, that individual, once it was handle free, no railings, it's like, nope, absolutely not, nope, nope, can't do it, can't do it. For like you're in a safe environment, we're gonna catch you. Nope, can't do it. So we just have to work and coax them, try and retrain the fear to reduce the fear of re-injuring themselves. Like no one wants to go through all the whole ordeal again because that sucks. And they have another time you have another patient that is like they're they're like you, like an athlete. Ah, yeah, I got it. 2 months later, come back. What happened to you? So I slipped again. Oh, what happened? Oh, my leg gave out and I slipped and I fell and I fractured the other side. And we're like, what happened? Oh, yeah, I thought it was fine. It's kind of like that. So you have individuals, and age is not necessarily, yes, when it comes to surgery, yes, age is a risk factor. But when it comes to physical therapy, age is not a risk factor.
Mhm.
Exercise can be done at any age.
Mhm.
But when it comes to surgery, yes, you just gotta. We in physical therapy we have something called flags. Red flag being a complete contraindication. No, cannot happen. Absolutely
Mhm.
impossible. Should not progress in this particular manner. Then you have yellow flags, which are okay. Keep that in mind. Don't ignore that. And heads up, this could be a factor in the future that could hinder, delay the outcomes. So, like your protective measurements, such as I say, if you had a carpal tunnel injury, and but you had depression. Okay, what does that mean? Depression can lead to not showing up to appointments. It could lead to, unfortunately, people who are self-harming. Could lead to lack of nutrition because they don't want to feel eating, lack of sleep, poor quality, although that hurts the function of the body. Could lead to just other issues, and that just it may not actually affect the issue you're working with, but it delays the healing time because they don't show up. They can't help them. they cut themselves. Well, if you heal for a carpal tunnel injury, they cut the same arm. Now you have to deal with that. You can't touch the arm because it's open wound. There's a lot of factors that you got to work around. And so,
you brought up a lot. Yeah, you brought up a lot of interesting points in that one point. One thing I've always wondered is how much education do you guys get about like sleep and nutrition?
Enough to talk to start the conversation, but not enough to really provide any true like assessment, like not assessment, but like a true plan of care. We help. We just steer the patients in the right direction. There are ways to go and further education, but at an entry level, it's not enough to truly create a plan of care.
Yeah, because like I've always, I mean, having been an athlete before, like I always felt like, yeah, that's like something you don't really get much education on, like how much hours of sleep you need to get each night, like what can you do to get better quality sleep at night, and like also like nutrition, like I feel like isn't really talked about all that much, like how much you'd be eating, like what you should be eating, and how that like in a sense helps you like grow in the sense of like when you're just trying to go for gains or when say trying to rehab or even deal with like pain or whatnot. Like yeah, that's just something I always like thought about, like I just feel like maybe like the current education system for like pre-health or like the health professions needs a little bit more of like those two things in terms of education.
It's hard to say that, to respond to that, just because of kind of the platform these professions are kind of based off of.
Right.
Like physical therapy is, yes, they're doing that, but when you talk about nutrition, okay, how much can you tell them, or how much can you know without actually becoming a dietitian or nutritionist? Or, for example, sleep, the quality of sleep. Yes, I get it. Sleep is important, but why are there sleep experts, individuals who have studied, sleep patterns, understanding brain wave function, kind of like when they hit stage 2, stage 3, stage 4, and when they hit the delta waves, and kind of I think it's beta patterns. But sure, the brain waves, the brain patterns from when they're in deep sleep. Individual, like there are experts in that can help an individual if they seek it, but it's at least physical therapy, at least in any healthcare, they don't have the education to generate a plan of care for that. But at least they can address, like, hey, have you ever thought of this?
Yeah, I mean, certainly, because like if for most people they recommend like 8 hours of sleep, right? And it's like 8 hours in a day. That's like 1/3 of your life. And I always considered like, like what can you be doing like to make that 1/3 of your life better? And I feel like that could definitely help in for some patients is like treatments or whatnot. I don't know, just throwing that out there. Just a good thought. So yeah, I know that's just a way to like I guess loop it back around to there's all my friends out there wanting to get more fit or lose weight. Like make sure you guys sleep and consider your nutrition as well.
Yeah, think of sleep and nutrition as, back to my car analogy earlier. Think of that as like keeping your transmission fluid good, your oil good.
Yeah.
Without that, you're not gonna have a proper functioning vehicle.
Yeah, it blows my mind that like a lot of people take better care of their cars versus their own bodies. Like they don't really see their bodies as like necessarily something that they need to take care of.
It's it happens with age and it happens with exposure. When you're younger, you're pretty much like, you see kids fall down 2 flights of stairs and they just pop back up and they start laughing it off. Whereas you see a person slip on level surface, fall down, concussion, possibly even might have chances to die just because they slipped and fell all over their own foot. But their previous exposure is, I fell down the stairs when I was younger, I'm fine. And then next thing you know, they're, well, they're that. So, it's hard to say. It's kind of like something that builds upon experience, but can't have experience if you never experienced it.
Yeah, certainly. Okay.
And, yeah.
I guess, since you brought up experience, I have to ask, how much different is physical therapy school, now with COVID as compared to like, pre-COVID?
Difficult. It's like I'm just going to keep within physical therapy and keep the explanation there. So, unfortunately, a lot of times, like the number one thing that the benefit of physical therapy is we're always told, put your hands on your patient. Now, this sounds kind of wrong if you don't take it out of context. But within the context of physical therapy, put your hands on a patient can tell you a plethora of information. So when I say that, put your hands on the patient, you're talking about, let's say, your shoulder, for example. I ask you to move it. If I can observe you moving it, that's one feedback I'm getting. I can observe your scapular motion. I can observe your thoracic motion. I can observe any muscular imbalances, any tightness, any weaknesses, etc. I can know if you're shaking or not. Great. But I can't see through your skin.
Mm-hmm.
Okay, so how do I know if what you're moving is exactly what I'm thinking? People often have compensatory patterns that is extremely, well hidden. Sometimes they compensate for such a long time, and they're so good at that they can.
Okay, could you explain to the listeners what compensation is? I don't think they're familiar with that term.
If those who are computer savvy, look up Trendelenburg gait pattern. It's a hip hiking due to a lack of glute extension, so their butt muscle is not kicking the leg backwards to help with that propulsion. Very common, but it can also lead to low back pain. Compensatory motion is they're using other associated muscles or other associated structures around a particular under or subpar functioning limb to make up for to make up and aka compensate for the function that they want to achieve. So, like for example, like you're closing a lid of a container. You can either close it by how it should function, or if there's something not right about it, you can also break off the lid and latch it in the same way. It closed, technically speaking, but is it doing its job? Not necessarily. So that's compensation in a very, very crude way of explaining it. But yeah, compensation is huge. Sorry, what were we talking about again?
Oh, no, it's fine. So I think you were talking about how when you compensate, honestly, like I'm drawing blanks. Like that was because I was just thinking about all the times I compensate in the weight room. Like, I definitely sometimes my form will break down when I'm say benching, just so I could will the weight up or whatnot. So yeah. I think it was in terms of, I know what we were talking about before that was the whole psychological side of like physical therapy. And I think we were still somewhat on that topic, but like more transitioning to how things have changed, pre versus post COVID. Yeah, pre versus or like in health and in physical therapy education.
Yeah, it's like I said, back to thanks for kind of back up. Yes, putting your hands on the back. It goes back to putting your hands on the patient.
Yeah,
you can visually see a compensatory pattern, but you can't necessarily identify if it's a compensatory pattern you're observing or something else is there. Or maybe, unfortunately, what physical therapy is, we see people and as you know, when you get to med school or when you apply to med school, you're gonna notice that humans have the exact same anatomy as each other. We all have the same muscles, the same bones. But then again, some people might have an extra one, or missing one, or is bent the weird, funny way, or it grew in a weird way, or maybe it was crushed, or maybe it was held off and for a longest time. You're going to get some weird patterns. And what you think is a compensatory pattern or a improper move mechanic might actually be correct, but you don't know unless you put your hands on the patient. Back to telehealth, you can't do that through a screen. You can't do that if you're, staring at each other and hey, move your arm this way. You basically rely on almost half to maybe even less than half of your ability to diagnose or observe a move mechanic. And so, people, I mean, yes, people do demonstrate something, but you don't know. You don't really know. So the online platform, physical therapy, has actually strained things, but, hopefully with improved technology and ability to record at different angles, and maybe this platform might change. Maybe VR might help with that. I'm not entirely sure, but telehealth has definitely changed a lot of things when it comes to that. You can still give programs, you can still modify things, but for me, one thing I love physical therapy is the kinesthetic, interaction with patients instead of just a verbal interaction. You can actually physically get them better. You can feel them getting better. You can actually get them to where they need to be or where they should be. And to me, that's, one major factor. So telehealth has definitely impacted physical therapy, and COVID has definitely put a strain on that. Hopefully the vaccine, that would help.
Yeah. Oh, but I guess in terms of the education though, since you're in your, I believe, final year of physical therapy school, how much different is it now compared to I guess what classes were traditionally?
Back to the telehealth part.
Are all your classes through Zoom or something?
Half of them are.
Half
that
of them
makes it very difficult because a lot of things about what we learn is techniques. Because we're past the first year to year and a half to 2 years is basically all didactic of what is, the neuron, how does the neuron function, how to, what's this, what's that. Good. Now that you got that, how does physical therapy manipulate this? How does physical therapy interact with this? How do you move this? If this is dysfunction, how do you test this? It's really difficult to do that via camera. So you can't. It's like you telling, you're calling somebody on the phone. It's like, hey, do you hear this annoying sound? I'm trying to figure out what this is, and you're like, I don't know what this is, because you're limited to whatever the phone quality is. You're limited to how the person's holding it, how close they are. If it's too close, you don't hear. You might not even hear what you should be hearing, and you're adding an additional layer of difficulty. And so they tell us that, hey, this is what you should feel. Okay, how do you should feel something that you don't know what you're feeling in the first place? Like, oh, hey, this is called a contracture, meaning no matter how hard you push, the patients may say ouch, or they won't move at all because they can't get to that range. All right, feel it on yourself. I don't have those issues. I can't tell you what a contracture is.
Right.
And when I went to my clinical, I was like, whoa, holy moly, this is what a contracture is. Basically, the person can't move. And they actually have physical blocks that restrict their movements. Nothing of what we learned could do that. And when you have the online learning, you can't teach that. You can't demonstrate that.
Yeah. like I've always wondered like how prepared will all of my friends that are in professional schools now be, because like I feel like a lot of you have addressed the very same sentiment that like, oh hey, I don't know how best this will prepare me to be the best possible healthcare provider I can be. Like I mean I understand that a lot of the time like people learn through their like once they're forced into that position of physical therapist. There's a lot of on the job like learning and training and like the continuing education. But yeah, that's like something I've always wondered like is effect of like the pandemic that like might have some lasting effects. And I was trying to think of maybe ways like we can help healthcare professionals in a sense like make up for the lost experiences that are a result of the way things are going in the world right now. And it's very promising to hear that like there seems to be a very successful vaccine. So yeah, hopefully we
Well,
can get back to normal, whatever normal
one
is.
one group that um, our school Creighton has a kind of addressed that was partially effective. I say partially with the loose, very loose like sentiment is communities and groups.
Hmm.
If you have a trusted group of individuals, trusted group of individuals that isn't going to go out partying, drinking, breaking mass laws, breaking social distancing, at the very least, yes, keep your mask on, yes, be safe, etc. At the very least, these people aren't going to get, spread infection.
Hmm.
And so for those who are in like this program, find somebody that you can trust that isn't going to be stupid and, go out and drink, go out and have fun in public and possibly put themselves at risk and putting you at risk.
Hmm.
That it's some sort of help is better than straight staring at a screen. At least you can interact with the person, even
Right.
just even though yes, it would be better if you had more people, but at the same time, there is a amount of people you can meet up, etc., and just kind of keep things safe. So
Hmm.
that's what helped me with your creating was the ability to work with a group of individuals that all had the same respect for CDC's guidelines, all had the same respect
Hmm.
for the university guidelines for it.
Okay, I guess a little more of a personal question. You're away from home, and like I know you've been away from home for like over a decade now, but like how is it different being away from home, you know, now versus, before the pandemic? And like how did you personally cope?
It really depends on what you're doing. For me, being away from home wasn't too bad because of I had my my desire of what I want to do.
Hmm.
I had my motivation. I had what I wanted to build myself. So being away from home wasn't absolutely horrible. Yes, it was troublesome. It was troublesome being 4,000 miles away from my fiance, 4,000 miles away from my family, friends, and yes, David, I did miss hanging out with you.
Yes.
You
I
little
was waiting.
goofball.
I was waiting for that. Thank you.
But there was, it is troublesome, but it goes back to the saying, if there's a will, there's a way,
Hmm.
and there definitely was a will, and I don't care how much stress I was under. If I want something, I will work for it, and that was one of the things. If it's yes, away, pandemic or not, it was. I'm on my way to achieve my goal is. My goal is to
Hmm.
become a physical therapist. Find a career, build for myself, and so pandemic only just put another roadblock.
Hmm.
You just one of my academic counselors was put a very 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 important thought in my head because I was like, this pandemic sucks. And then he straight up said, yeah, it sucks for all of us. And I'm like, yeah, that's true. He's like, so what? And I'm like, what do you mean, so what? He's like, so what can you do about that? I'm like, yeah, I just gotta endure it and you suck it and you suck it up and kind of do it. He goes, yeah, that's true. Suck it up and just do it. I'm like, okay, that sounds kind of like, but then he goes, the faster this pandemic has gone for a year now, it's not going away anytime soon. It's going to be there next time. It's going to be there next year. It's going to be there maybe at this point, like the flu is always going to come back, or maybe not. The faster we accept that this is the new reality, the faster we can cope with it. And I was like, okay, shit, that's not wrong.
Yeah, I mean, just dealing with that uncertainty, like not many people can really handle like uncertainty. I mean, honestly, like even me now, like 26 years old at the tail end of grad school, like I'm really trying to finish soon. I just have to finish writing my thesis, and it's like yeah, I really don't know what's gonna happen like after this, and like COVID certainly threw a wrench in my plans last year. Last year I had planned to take the MCAT and apply, but the two times I was scheduled to take the MCAT, my test dates were canceled due to the pandemic. So, I mean, that certainly threw a wrench in my plans. And also, like, doing research. Like, we had a couple of lab shutdowns due to COVID, so I wasn't able to, like, finish research. But, I made the best of it as, I thought I could. Like, yeah, I certainly feel like that threw me into, like, a little, like, rut since, like, I had this, like, grand plan for 2020. And, like, pretty much most of it fell through, but I still made, gains in terms of like, for my own personal goals or whatnot. So yeah, like that, this is kind of where this podcast kind of started too. It was a goal that I had early on. I really wanted to start it in March, but yeah, there's a lot happened in March, and yeah, I'm glad to actually have, taken a step forward and actually starting this podcast. But yeah, those are very interesting points that you brought up,
Yeah, like I said, it's if there's a will, there's a way. But at the same time, the sooner you come to reality of things, the sooner you can act upon it. I'm the kind of person who likes taking things head on, because if I don't take it head on, who else is going to take it head on? And if someone else takes it head on and you don't like the way they run it, guess what? It's back to square one for you.
Yeah, that's good.
So,
all right. Was there anything else you wanted to talk about? We're almost 2 hours in now.
No, I think we covered a lot of topics that, I mean, yes, there are a lot of things. You hit a lot of icebergs. I mean,
yeah,
the tip of the surface.
Definitely, like yeah. Well, definitely. Like I mentioned, a lot of things that you could have expanded on more. We can definitely. I feel like you'll probably be on this podcast again. Hopefully, when you're like a full blown like DPT, and like I'd like to see you as like a leader in the field one day.
Yeah, I get that first.
yeah, certainly, of course, right? But like I don't know, like the thing that I respect about you and like about you a lot is that like when I see you, I think that like honestly, like don't take offense to it or anything. Like when I see you, it's like, oh, this is a guy that fucked up his life because like he didn't do that well in like undergrad. But then you're able to like turn it around and make something, of yourself. And to me, like that gives me like a lot of hope. And that's like a very inspirational story. Like I don't know. I feel like you in a sense like downplayed a little bit because like I was honestly there when you were at some lows where it's like you were discouraged about like getting in and everything. And like, it's just nice to see that, you achieved your goal of getting into like physical therapy school. And I'm really looking forward to, whatever it is you want to do after physical therapy school.
My thing is like I say for myself is that I have a certain tenacity, and I am, tenacious about trying to, I want something. I'm going to fight for it. Yeah, I guess there are some ways to go about that, but like for me is I I was put in the disposition of my grades where I was, but that doesn't necessarily mean that there wasn't any other way. I sought help, and that's what actually helped me is the fact that I sought other individuals to help with this. If I didn't have the guidance of the academic, the vice director, I wouldn't have gotten as far as I have. If I didn't have the encouragement from, and a lot of the therapists I worked with, Jay straight up said when I first didn't get in, "What the actual hell? Why didn't you get in?" Even at the end of my grad school, when I got in, I first got rejected. Even the academic director, he's in admissions. He is the guy who says yes or no. Well, maybe he's not the only one, but he helps with yes or no. He looked at me, he goes, "I don't know what the hell happened. You should not have been rejected at all." He's, like very few times, he goes pretty much tell me that. He's like, "Hey, I don't understand what the hell happened. Your interview was phenomenal. Your grades, you turned it up, you did a 180-degree turn. You got there. But, it was me just like talking to those individuals, seeking out help, being, vulnerable. It, helped me understand myself, and, that it's hard to, stand up to your own faults. It's hard to like expose yourself to humility. It's hard. It's a big bite to take. But the sooner you look into it, the sooner you see like constructive criticism, the sooner you see that, the better you can make, come to reality of things. The faster you can make the corrections, the faster you can look into things. A lot of individuals, it is rough, and I don't know any other way except for look into it. But once I realized where I was, what I need to get to, where I need to be, and who I need to talk to, and who needs help, I did whatever I could to get there. And so, if those who are trying to get to physical therapy school and just, have, not great GPA, sit down with their, these counselors, sit down with the directors, sit down with these programs, and, if you don't get in, I shot like thousands of emails saying, "Hey, why? Can you at least tell me why? I don't care if I don't get in ever again. Tell me why. Tell me what is the issue." And they say A, B, C, D. Okay, then inquire further. Be tenacious about things.